Today, we're opening an investigation into what is, without a doubt, one of the most severe public health crises of our time. We're looking at the intersection of extreme heat and toxic air, where millions of lives in India are hanging in the balance. And make no mistake, this isn't just an environmental story, it's a test of a nation's very ability to protect its people. We're going to start with a central piece of evidence. Just look at this number, an estimated 2.1 million deaths in a single year, from air pollution alone. The image of the scales you see here isn't just for show. It really represents the core of our investigation, a system of justice and public health that has been thrown profoundly and dangerously out of balance. So first, we need to examine the scene of the crisis. We're looking at a nation that is, in many ways, under siege from two powerful forces that have come together to create a true public health emergency. And this really captures the dual nature of the problem, right? You have decades of rapid industrialization, unchecked urbanization, and a heavy reliance on fossil fuels. All of this hasn't just polluted the air, it's created a constant, relentless state of environmental stress. And this combination of toxic air and soaring temperatures, well, it now affects the daily lives of hundreds of millions of people. Now, as you know, every investigation needs hard evidence. So in this section, we're going to present the data, treating them like exhibits that truly quantify the staggering human cost of this crisis. Let's circle back to that number we started with, which comes from the State of Global Air 2024 report. 2.1 million estimated deaths in 2021. I mean, let that sink in. This makes air pollution one of the leading causes of death in the entire country, a silent epidemic that's basically hiding in plain sight. And beyond the tragic loss of life, there is an absolutely crippling economic cost. The World Bank estimates that in 2019 alone, the Indian economy lost $36.8 billion. And that's not just a number on a page, that's lost productivity, it's skyrocketing healthcare expenses, it's a massive drain on national resources. You know, sometimes it's the specific events that reveal just how lethal this crisis is. During a single heat wave back in May 2010, the city of Ahmedabad reported a 43% jump in all-cause mortality. This isn't some future projection. It's a documented spike in deaths that is directly linked to an extreme heat event. And the damage goes so much deeper than just respiratory issues. The research shows a devastating systemic impact on the human body. We're talking about everything from heart and kidney failure to mental health crises and terrible birth outcomes. It's even correlated to a higher incidence of cancer and infectious diseases. It is quite literally a full-body assault. This evidence also builds a case of profound inequality, because while everyone is affected, the burden falls heaviest on the most vulnerable among us: outdoor laborers toiling in the sun, pregnant women, young children, and the elderly. This is why it's not just a health crisis, it's a social justice crisis. Okay, so with the human cost clearly established, our investigation now pivots. We're going to put the system itself on trial. We're going to scrutinize the laws, the policies, and the institutions that were designed to protect public health and ask a very simple question: why are they failing? And that brings us right to the heart of it. The problem isn't that there's a lack of laws on the books. The problem is a failure of their effectiveness. We have to understand the systemic breakdowns that are preventing these legal frameworks from actually translating into clean air and safe temperatures for people. Let's start with the foundational law here, the Air Act of 1981. On paper, its promise was clear. It set up pollution control boards and gave the state the power to regulate emissions. But in reality, it's a law that is completely stuck in the past. It relies on a painfully slow criminal penalty system. The boards it created are chronically underfunded, and it almost completely ignores modern pollution sources like indoor air quality. This chart here illustrates a really fundamental flaw in the whole system. You cannot manage what you do not measure. And while yes, the number of monitoring stations has grown, the coverage falls desperately short of what's actually needed to get a clear, comprehensive picture of air quality. This data gap just cripples any attempt at effective enforcement. So what about more recent efforts like the National Clean Air Program? Well, its ambition is definitely commendable, a 40% reduction in particulate matter by 2026. But just look at the execution. Implementation is all over the place. Coordination between agencies is weak. And get this, in many cities, less than half of the allocated funds were even used. Crucial studies to figure out where the pollution is even coming from are complete in only a fraction of the target cities. And look, this isn't just our assessment. This quote comes directly from a comprehensive legal review by the United Nations Development Program, and it's a direct indictment. It confirms that the very bodies tasked with protecting the public are being systematically hobbled by a lack of funds, a lack of capacity, and a lack of real power. So, after examining all the evidence and interrogating the system, it's time for a verdict. But we're not going to stop there. We will also lay out a clear path forward, a blueprint for accountability that's based on expert recommendations. The verdict is clear. This is a systemic failure of governance. This crisis continues not because of a lack of laws, but because of a deep, pervasive failure to implement, to enforce, to fund, and to modernize them. It's a massive gap between promise and practice, and millions of people are paying the price with their health. But failure is not the end of the story. That same UNDP assessment provides a clear path to accountability. First, modernize the 40-Year-Old Air Act with faster civil penalties. Second, dramatically expand monitoring and make all the data public for real transparency. And third, give the pollution control boards the financial independence and the actual authority they need to enforce the law. And so, our investigation closes here. We have a diagnosis and we have a clear prescription. The path to accountability is known. The crucial question that remains isn't really one of policy, but one of will. Will the systemic will to act finally match the systemic responsibility?